service specification and get that in going forward. In the contract for this year, there's two simple quality metrics on top of what's been there previously, which is that people must participate and collaborate in cohort review by sector on a quarterly basis. And the outcome of those cohort reviews must then be discussed between the Commissioner and trusts at their clinical quality groups. This will begin to put pressure on providers and pressure on CCGs to take action against TB. And contact tracing is looking for an average of 5 and then going up to 10 contacts per TB notification. As I said, the National Collaborative TB Strategy is being launched today at 8 o'clock at the Houses of Parliament. It's a consultation document, will be available. I like this, I took this straight out of the email it sent to me sometime today. I checked just a couple of minutes ago, it's not available yet, but it will be available sometime today. Now that is an embargo document, but what it might contain is 9 areas where the national strategy is focusing on, or might focus on, going forward. And I think it's really important that people have a look at this. I think it's really good for trainees to have a look at this. I think it's good for everyone else to have a look at it, because under each of those headings, there will then be a lot of detail. And they're looking to begin to set national objectives, which then have to be interpreted in London, and they're about all of the things you would expect. Access and early diagnosis, high quality diagnostics, treatment, contact tracing, vaccination, drug resistance, TB in underrepresented populations, and I know you've got a session from Find and Treat later on, and that's a really, really important area that must be pushed. I said earlier on, I find it very interesting, Graham, I find it very interesting how, again, nice guidance on new drugs have to be implemented immediately, nice guidance on TB in hard-to-reach groups. Well, we might or might not do it. Let's have some conversations locally. What are we going to do? It is interesting, and I think that needs to be pushed. Detection and treatment of latent disease, which I think is the big way to go to take this forward. So I'll finish at that point in time. Hope I haven't overstayed my welcome too much, and make sure that we try to get a more positive approach to TB than this. Thank you very much. Right, well, one of the things that's really, really important about TB across London is it's really local in terms of what needs to be done. And I think what's really important is any sort of pan-London plan is setting objectives, goals, and the structure as to how to get there, but actually how it works in practice is local, and it depends on your understanding of the local epidemiology. So the first thing is, to go back onto Graham's point, is really understand the local TB, and that's where cohort review begins to get into that, and then identify why is it that we're not getting 5 per notified case. And is that a resource issue? So is that there's not enough nurses? Is it because we're calling people up but they're not coming because we're not tracking them? They might be in hard-to-reach groups. We're getting a lot of people coming from groups who then DNA and go through and take through from that point of view. Is it because the clinicians aren't getting enough information for us? And then taking the outcome from that, the strength, if we get this into contracts going forward, is that then there will be real conversations between CCGs and providers about how to get that up. And if, as is often the case, it's pointed to that there is insufficient TB nursing resource and administrative support for those TB nurses, then I believe that will flow once you get that into that position. But you need to understand your local epidemiology first and what's happening locally.
Could I make a point? I think your first point on access is absolutely crucial, because there are 2 aspects to this. Firstly, it's well known that it's quite difficult to get a GP in London, especially if you're undocumented, you haven't got papers, and you've got no photo ID. Now, I mean, I hope tonight you could maybe make a point that at the moment, as things stand, GPs and everyone are allowed to register anybody, regardless of status. And in fact, the local medical committee, East London BMA, has informed us on an FOI that it is actually not legal to ask a patient for a photo ID or indeed proof of address in order to register them as a patient. I don't know whether the patient has ever challenged this, but anyway, that is the case. And so that's one thing. The second thing is, surely, why cannot we it be made public that people can access TB diagnosis and screening without, as they can access an STD clinic. Because I've been, there is apparently a study by Helen Broom at UCH which shows that people are actually quite good at diagnosing their own TB. And doctors may often forget to ask if you've got sweating or weight loss. Not that that's necessarily going to be the crucial thing, there may be other features. But I know that people don't like the idea of it being on all the tubes. You know, London is the TB capital of Europe. If you've got these symptoms, go to one of the following hospitals at one of the following times. Because surely, in that way, people would at least get into the system. We know that TB and all infectious diseases are exempt from charging for anybody. People have actually got to get a diagnosis.
Yeah, if I can come in and answer would probably be quite useful.
I also point out that I'm from Lower Clapton, and we're one of the practices in Hackney that has been doing screening, and we did 50 MON2s in the last year, according to NICE, age 0 to 35, people from outside Northern Europe. So not particularly high-rate countries, anywhere from outside Northern Europe. And of the 50 MON2s, we got 9 latent TBs. So that's nearly 20%.
Yeah, I should have mentioned during my talk that there's some really good practice going on in different patches in London looking at the latent detection and screening, and some areas have just gone on and started doing it. Hackney, I think, has led the way on some of that stuff. Others in our local area, we've had two research projects that have been going, of which we'll get the data coming through, and one of those links with the TB Predict study, which again is looking to see the answers for latent disease. All of the points you meant about TB awareness were in our original TB plan. We actually did produce some posters that went round to all hospitals and GP surgeries, but also we wanted to do a big public plan, a big public campaign, etc. And if we had got funded in 2012-13, that's exactly what we would have done. I mean, we need to get across to the public, but also to healthcare professionals, the idea of alarm symptoms and TB. And the one which I think people always forget, I think you've got the fevers and sweats, absolutely right, you've got the chronic cough, but also is the unexplained pain. And I think with the extrapulmonary disease, I mean, getting people to think of TB when there's unexplained persistent pain, pretty much anywhere in the body, we've all seen it, I think is another one to push forward on that.
I'm up in Barnet, and I'm just wondering how in different areas people, how GPs access that screening. So how do they access Barnet and IGRAs? Because for us, they have to set them to...
Yeah. Again, it's all local decision making. So in some areas they're not funded and GP is not allowed to do them. In other areas, like the example we heard in Hackney just now, there have been pilots going, or where GP groups have decided themselves that this is something they want to do. CCGs have wanted to do. Otherwise, it is referral through to hospitals and to TB providers, where there is no consistent approach to how they are done. And I'm sure it's the same with Graham. At least about half of the referrals where someone's had an IGRA test done in the community, you know, you're not really sure why it was done, and the other half, it is actually useful to have been done. So I think there's a real need for consistency there, and again, that has to come through setting the direction about what is expected for screening for latent TB, and then interpreting at a local level as to what needs to be done and how is that going to be delivered locally will be different. We're in a health service now where however much we might like to be able to sort of press a button over here and everything happens right across the whole of an area, you know, local decisions will be made, and I'm sure that we will be doing things differently pretty much in every locality across London. Providing we can actually focus on the same objectives, then we should make progress. Good, thank you very much.